Hello viewers, I'd just like to relate a emergency medical situation that we experienced a couple of days ago when we were hiking up in the Bunya Mountains, southeast Queensland, Australia. The area is well known for ticks, and one of the lady members of our group, I'll call her Jane for privacy reasons, had a very severe reaction, anaphylactic shock to a tick bite. The area was in a remote area for medical services. The closest paramedic ambulance crew was about an hour away. Jane started to suffer the symptoms of very serious reaction to the tick bite within an hour. So the first aid kits we had, and my wife carries it with her, are antihistamines. She's allergic to certain pollens in the bush from native trees and stuff. What happened was that as the condition worsened, we're on the medical hotline by cell phone, which was very patchy, and they're asking a lot of questions as the requirements are. Her conditions started to deteriorate very quickly, with nausea, headaches, muscle aches and pains, the early stages of anaphylactic shock where the tongue was swelling and her airways were becoming constricted. She had trouble breathing. My wife gave her one of these antihistamines to try and bring the condition under some form of control while the ambulance paramedics were on their way. The medical hotline we have here in Australia, the doctor on duty at the time decided to dispatch a Medevac helicopter to get her out and transport her to the nearest hospital. On the subject of antihistamines, a lot of people have allergic reactions to insect bites of all species. Some release small amounts of toxins such as bees, ticks, some ants maybe. The list is endless. And for Jane, it was the first time she had a bush tick on her. It hadn't been on her for very long. So on the topic of antihistamines in this sort of situation, and I do stress, I am by no means a medical expert by any stretch of the imagination. First aid is as far as I go. But the antihistamines had a desired effect of slowing down the anaphylactic shock. And this was confirmed by the more professional medical staff that treated her, both the ambulance paramedics, the doctor in the Medevac chopper, and of course eventually when they got her to hospital, the treating doctor said was the best thing that could have been done. Now, having said that, antihistamines, a lot of people can't take them. Due to certain compounds in them, certain brands, underlying medical problems, and they may react with medication they're already on, short or long term. So, in the situation that happened to us, it could have turned out to be a life-threatening situation. Something else that I would suggest that you think about carrying in your first aid kits when you're out trekking in the bush. The Australian bush is very, very well known for tick paralysis. I do know a number of people who have had very, very severe reactions to the ticks here in the Australian bush, and they've had to seek advanced medical attention. So it may be a thought to check on the use of antihistamines. By all means, and I do emphasize this, check with medical professionals on the use of antihistamines. As far as insect bites go, certainly reactions with medications that people may be on, short or long term, and of course underlying medical conditions which may not be suitable to use antihistamines on. So that was a story that from our own personal experience. Please do the research into it. A lot of medical questions were asked by the medical hotline about Jane, and this brings up another topic. She had just moved down to our area, and we weren't sure what medication she was on. We were aware of some of her underlying medical conditions, and the questions that were asked by the medical hotline were very thorough. In saying that, people started to panic, and of course when they're trying to get this information to find out what is the best treatment for her, advanced treatment, people getting panicked and all that sort of thing is wasting precious time, particularly when it could have been a life-threatening situation. As the professional medical said, it was a life-threatening situation. It's just that my wife decided to give her an antihistamine, and that saved a lot more complications. But again, I say, please do the research. Talk to medical professionals about the use of antihistamines. There are certain brands, certain types that are used for different reactions, allergic reactions. We've taken that advice on board. We already had antihistamines in our backpacks and first aid kits. As I said, the medical staff for advanced treatment, the paramedics, and at the hospital said that for this particular occasion, for a tick bite, it was the best thing that we could do to help stave off anaphylactic shock and other side effects of the tick bite. And again, please check with medical professions about the use of antihistamines for insect bites and such like. And here's an idea that might be worth considering or taking on board when you're out camping or trekking through the bush or the woods, wherever you are in the world. It's probably a good idea to have a list of underlying medical conditions and including medication that people may be on. Now, I realise there are privacy considerations here, particularly if members of your hiking party aren't family members or perhaps close friends that are more familiar with medical conditions and medication and so on. If you're with a bunch of strangers, just a hiking group, get together, and something happens that the patient or the victim is unconscious, and you're calling for medical help and they're asking a lot of questions, and of course if they're unconscious they can't answer them. So it may be worth considering, but in a critical situation it could mean the difference between saving someone's life or someone finishing up on a slab in a morgue somewhere, and that's the way you've got to look at it logically. Thank you for watching.